We were all shocked by the assassination of Brian Thompson yesterday, who is the CEO of United Healthcare. Unfortunately, this is not the first time that United Healthcare has been connected with some serious atrocities. One of the biggest stories of healthcare this year about United Healthcare has not been told, and I want to share that with you today. So please listen to the end and please share this video. In February of 2024, Change Healthcare, which is the clearinghouse United Healthcare, was cyber attacked, which means it impacted payments to healthcare organizations like small physician's office and even hospitals. So I want to break down what this really means with an example. Imagine you own a small spa and you accept gift cards, right? And it turns out that 50% of the people that attend your spa use this gift card to get their services. And you've promised to take these cards, you have a contract, you have to recognize these gift cards. So you have half of your clients coming in, they're using the card, and suddenly the card doesn't swipe or it's not giving you money, and you're trying to figure out what's going on. So you call the gift card company and they tell you, you know what, we've had a cyber attack and I'm sorry, we're not able to issue payment to you. They can't give payment. So now you're doing all this work, doing all these massages and all these services, and the gift card program is not working. What makes this extra atrocious is there is money on these cards. The gift card company is still accepting payment for these cards, but they're not paying you. This is exactly what happened with United Healthcare earlier this year. People were still paying their insurance premiums, but those premiums were not getting to the practices in the hospitals that were delivering the care. So small doctors' offices, especially offices with less than 10 doctors, weren't getting paid for months. There are some hospitals that were losing $20 to $100 million per day because of this attack. This is a huge threat to the US healthcare system, and it's the reason why we don't want monopolies, because one company having all that power impacted care for so many patients. But wait, the fallout actually gets worse. For small practices that couldn't handle these cash flow issues, many of them struggled. Some of them even went under. United Healthcare did not do much to help these practices. And in fact, they offered to give these practices a loan for the money, and sometimes only in the amount of about $4,000. Many of these practices were doing hundreds of thousands of dollars a month with United Healthcare. So a $4,000 loan with interest was not a very palatable option. For the practices that were in most dire need, some of them actually did go under. And guess who came around to buy them? United Healthcare. To this day, I don't think there's really been any consequences for this massive fallout. There's been no congressional action, there's been no penalties, there's been nothing. So if you are accepting health insurance in this country, you are at risk of companies like United Healthcare not paying you money. Of course, I do not condone violence, but the death of Brian Thompson yesterday highlights what can happen and how serious things can get when we mess with people's lives and livelihood. So the impact on the U.S. healthcare system by United Healthcare was astronomical, and it makes me very frustrated that they've never been held accountable for what happened earlier this year, how many physicians, patients, and institutions impacted.